Welcome back to the channel where medical topics are made easy. Today's hot tip is all about cardiac labs that nurses misread. So stick around to find out which 3 cardiac labs nurses misread the most. And don't forget to like and subscribe so you never miss an episode. First, let's talk about BNP, brain natriuretic peptide. It's a hormone that's released from the heart when it's feeling a little overwhelmed, and the walls of the ventricles are stretched like in fluid overload. But here's the thing, it's also cleared by the kidneys. So if your patient has kidney disease, their BNP will be high because their kidneys can't clear it properly. A patient with heart failure, their BNP is elevated, but it won't be as high as these chronic kidney disease patients. So how do you tell them apart? Well, the key is to look at the patient's symptoms and assessment findings. If they have lung congestion, edema, or weight gain, they're likely experiencing heart failure. Don't just rely on the BNP, trust your assessment skills. Our nurse meme for this is, "Oh my God, the BNP is 3000 in CKD, chill." Second is troponin. It's a protein found in heart muscle cells. And when those cells get damaged, like during a heart attack, some of that troponin leaks out into the bloodstream. But here's the deal, it can also go up in renal failure, sepsis, PE, and even after running a marathon. So how do you know if it's just a false alarm or something serious? Well, first off, look at the trend. Is it rising or falling? If it's stable and flat, it's likely a false alarm. In a real heart attack, the troponin level will rise and fall in a characteristic way. It'll usually peak within 48 hours and then start to drop. Also, don't forget to consider the patient's symptoms and EKG changes. For example, if a patient presents with chest pain, shortness of breath, and their troponin level is rising and falling, you should definitely suspect a heart attack. Here's a visual to help you remember. On the left, you can see a troponin curve that rises and falls. This is what you might see in a patient who had a heart attack. On the right, if you see a flat troponin trend, they might have elevated it for some other reason, but it doesn't indicate a heart attack. Providers call it demand ischemia, or troponin leak due to imbalance between myocardial oxygen demand and supply. Remember, the EKG can also provide clues. During a heart attack, you may see ST segment elevations or depressions, as well as new left bundle branch blocks. And third is CKMB. It was the go-to cardiac enzyme test before high-sensitivity troponin came along. Nowadays, it's pretty outdated. However, there's still a few situations where it can be useful. For example, if a patient has had a heart attack and their troponin level is still high, you can check the CKMB to see if it's elevated. This could suggest that the patient is having another heart attack. Otherwise, troponin is the better test to use. We made it. If you like this video, check out our video on lactic acid lies. See you there. Thank you for supporting my channel.